Okay, thanks everybody so much for coming out. My name is Philip Warner, I'm Head of Adult Services here at Fairfield Public Library. So I'd like to welcome you all to another really important and great session that we are having with Paul and Susan Doyle from Oasis Senior Advisors. They're with us for 6 months, so once a month we gather for a conversation about the sandwich generation. Next month, in April, we're going to be focused on skilled care. In May, there'll be legal issues and best practices. And then in June, navigating hospital stays. So really this whole, starting in January, it really covers all the different facets of taking care of your loved ones. So I will now introduce Paul, and then he can introduce our speakers for tonight. Thank you very much, Paul.
Thank you, Phil, and welcome everybody. There's a few familiar faces and some new ones, so welcome to those. As Phil mentioned, this is an ongoing thing and an ongoing series, and we like to encourage across the series that this is about an ongoing conversation that you should all have. Is, you know, you're going to pick up stuff now, but most importantly, what we're going to develop is the habit of talking about senior care and having a plan, because it's going to change. Things will change, and you need to know what resources are out there, so when you need them, you're not caught flat-footed. Tonight we call it Local Lifelines. We have with us Regan, who's been in the social work field for over 20 years, specifically working with the senior and disabled population. She resides locally in Seymour with her 2 kids and her spouse. In addition to being a working parent, she was also the primary caregiver for her grandmother. So she knows firsthand the vital role that caregivers play and the importance of community resources. So her right is Julie DeMarco, who's been a social worker for 35 years and a Fairfield resident for 32. With 5 kids, kind and patient husband Vince, previous work experience as a senior center director, program director, hospital social worker, and cared for both her parents who had Alzheimer's. Heartbreaking and incredibly meaningful. And I will tell you both, you didn't know this, right? Because I just asked you for 2 or 3 sentences on you personally before we get into the specifics. But did you notice that both of these professionals that have decades of experience both ended and spent a third of their description on how they cared for a family member?
God, it's interesting. I know. Gosh, we should have our flowers up here.
Because we all do.
Yeah.
We all do. It's just in different measures, takes different shapes and different forms. So we're going to start a little bit. So Julie's director of social services here in the town, and Kitty is. We all quickly go and say SWCAA. Like everybody knows what SWCAA means, and it's an acronym, and because it's the Southwestern Connecticut Agency on Aging, and that's why we say SWCAA.
Yeah, it's a mouthful.
And we're going to get into a second about both of those organizations or guideposts for you, and then into what they can offer and where they can direct you. But I want to start with something that we touch in each of these. Like, how do I know when I'm supposed to be doing anything? And I like to say that the first thing, even if I'm totally independent, have no care concerns whatsoever, it's the paperwork always comes back. So whether I go into a hospital, or I go into a rehab, or I talk to a home care, or I talk to a financial advisor, or I talk to somebody at local social services, there's going to be paperwork involved. So before I need care, what should I have prepared before I come and see either you or your organizations? What are some of the things people don't have and should have?
Hi, good evening everyone. Thank you again for coming. So my name is Katie. So I am from, as Paul said, Southwestern Connecticut Agency on Aging. I hear this question a lot. What I always recommend to people is kind of like how you said, Paul, before it comes to that head, you know, before your loved one is in the hospital because of a medical emergency, before you're ready to think about what are the next steps for mom or dad or my loved one to be safe at home. It's just that conversation of, you know, where are these documents? State programs, sometimes town programs, they will ask for information, verification information. Do you have a copy of the birth certificate? Do you have a copy of your, your spouse's death certificate or a marriage license? Where are your banks? You know, when we were assisting my grandmother, we didn't know that she had as many bank accounts open as she did, you know. So where are those banks? Not asking you that you have to get a multitude of bank statements, but at least some knowledge and basis, so that you don't feel so lost. Gosh forbid you do fall into that circumstance of now you have to gather that information to pass along to somebody like Julie or someone like myself. And again, it's just starting that discussion and putting that information in a simple little folder and knowing where it is as well. So you're not searching through drawers, searching under mattresses, searching for that information, because you know, when it comes to that time, it's very emotional and you're going through a lot. So that's the last thing you should be searching for is the paperwork and the documents. That would be my suggestion.
Can I add to that?
Mm-hmm.
Something that the town is working on right now with the fire department is making sure that people have their DNRs, their do not resuscitates, and their advanced directives and their wills. The fire department suggests putting them in a Ziploc bag, like in a go bag, as you know, you might have done when your kids were little, that you had a grab and go bag. A list of your medications. If you're coming to social services and you have a choices appointment with a Southwestern Connecticut Agency on Aging trained choices counselor, you're going to want to have, you know, your bank statements, your list of meds, maybe not the bank statements for choices, but you know, tax documents. You're going to want to have everything that you would need to make decisions for yourself for the people you're caring for. That was a mistake we made with my father, who died first from Alzheimer's, that we had most of this stuff together and we thought we were really good. And then we found out we weren't, we were pretty good. And so we built a whole, you know, a big notebook of what documents were, which banks, where insurance was, where pensions were. All that stuff can be in one place, and while you're, whether it's for you or somebody you love, while you're thinking of it, it's just a methodical, it's a commitment to getting it done, so you have it. And once you have it, you know, you can add to it or change it, but at least it's in one place you know where it is, and then have something in your freezer. The fire department will look in the freezer to see if you have a Ziploc with your DNR and your advanced directives.
Right. And I would say, just on personal experience, update it. So yes, start it right now.
Yeah.
But update it. I'll give you two examples. So when I got involved in the care for my father's his POA and healthcare proxy we went through, he had a DNR that he did when he was 60, and when I'm talking to him in his 84th and final year here, things had changed. So he said he didn't want a long list of do nots, no antibiotics. Make that. But, well, you know, no, of course I want antibiotics. And the other example, my financial planner gave me, so watch your insurance policies, because he talked about that the beneficiary on an insurance policy who is an ex-spouse is still the beneficiary unless you change it.
Mm-hmm.
And
Yep,
that
that
can
is
happen. And it was also just a good practice because you remember where it is.
Mm-hmm.
I can't tell you how many times I put paperwork, this is really important, I'll put it here. And then a year later, that's not an important spot anymore.
Mm-hmm.
So keep active in all of this.
Yeah.
So let's dive in a little bit, because the two of you were very, very similar in that description, but the services you bring, while similar, there are distinct differences. So Kate, let's start at the big level. You're the state of Connecticut, aren't you? This Southwestern Connecticut, that sounds like it's the state.
Yeah.
So what's SWCAA?
Sure. So SWCAA is Southwestern Connecticut. Hello there. Southwestern Connecticut Agency on Aging. We are not the state of Connecticut. We are, the simplest way that I like to explain it is we are state contractors, okay? We are one of 5 agency on agings in the state of Connecticut. We handle 14 towns, from Fairfield, Trumbull, you know, Easton, down to Greenwich, okay? We're funded under the Older Americans Act, which is a federal funded program. So if you had a sister who lived in Massachusetts that was caring for a loved one that was older or disabled, she could reach out to the Agency on Aging in her neck of the woods. I myself helped a dear friend of mine whose mother and father resided in Virginia, and the father was elderly and needing increased services and supports to maintain himself safely in Virginia, so I was able to connect her with the Agency on Aging down there. But we are not the state of Connecticut. Many people, unfortunately, sometimes when we go out and do home visits, they become a little nervous, you know, because they're thinking, oh, this is the state coming, I'm not coming in with a badge, I'm not there to remove anyone from anyone's home. We are care managers to come out, provide information, assistance, referrals, sometimes assist them in getting into some home care style programs that the state of Connecticut may offer, but we are not the determining factor, so we do not determine whether or not someone gets onto a state program. We just come out and do the assessments and then provide that information to the state, if that makes.
Yep. And we'll dive into some of those programs in a second. So Julie, in your position, similar, because we're offering those supports, you of course are broader in that it's social services, so it's cradle to grave.
Right.
But we're gonna focus on the middle part of our part of the sandwich generation here. So tell me what services are offered through the town, or
Right.
why I should be thinking about you.
So we often get confused with the Department of Social Services, which is the state program. We are not the state either. We are the town of Fairfield. We only provide social services to Fairfield residents. The senior center, which provides wonderful programs to help with social participation and combat isolation, that's for any town. Any town can come to the senior center, participate in the congregate lunch, participate in programs, but social services is exclusively for Fairfield residents. And you'll find most communities in Connecticut have the same kind of model. Some states have the county model. This is a town specific. So when somebody comes to social services and meets with a social worker, we do a basic intake, which is just getting a sense of, the first question is, why are you here? What's on your mind? What are you worried about? People, sometimes it's hard depending on what the need is. Sometimes it's hard to walk through that door, and we don't judge. We try not to make anybody feel as though they're lesser than or don't belong there. It's very important to be able to ask questions and to get information. So what we'll do is we'll do an intake and assessment to find out, maybe somebody coming in is eligible for energy assistance to help pay for some fuel bills. Maybe somebody needs assistance getting groceries or stretching $1 till the end of the month, or assistance with rent. So we have all sorts of programs to try to help when somebody is in crisis. And we have ongoing programs. Energy assistance we do every year. We have support groups. We have a bereavement group, and we're starting a caregiver group probably not until the fall. We had one that just recently ended. We offer Medicare counseling from SWCAA, the Choices Counseling. It really depends on the person. So if somebody comes in and it's a service we don't offer, we will find it for them. We often work with agencies and organizations that provide services like you do, that we connect people with, or medical equipment, that kind of thing. The blue folders on the table have a whole bunch of resources legal services, home improvement, that kind of thing. Pretty much anything you can think of within reason.
And when, I'll continue with you for a second, Julie. When should I come to you? What happens in the house? Is it when I'm in the hospital and I don't know what's going to happen, or what are some more common indicators that maybe I should have a conversation with somebody else?
That's a great question.
I remember with my mom, before she had Alzheimer's, it wasn't diagnosed at the time, but we started to notice the same turtleneck a couple days in a row. It was lovely, it wasn't disgusting, but it was the same turtleneck, and that was not her.
Right. So there's a few times. I can give you just little pictures. In our life with my mom, when she was my father's primary caregiver and we helped, she was able to mask her level of functioning, and we didn't realize that she had dementia because she was doing such a wonderful job with my father. So for us, it was once he was gone, we were afraid she was depressed, and then we noticed she wasn't eating well. She was a wonderful housekeeper. She was a fashion plate, which I did not inherit, but she was just incredibly fashionable, like your mom with the turtleneck. But things were slipping, and she wasn't interested in going out and doing things. What we find is that oftentimes it's a daughter, sometimes a son who just wants to find out what's available. But by finding out what's available, you know there's a little more to it than that because they're curious. For a senior to come in and ask for help, it's fear. You know, they're afraid that they're slipping. They're afraid that they need some services. You know, we have, and I have to really couch stories because people will know, but we have a few seniors who are well into their 90s, without dementia, drive, are so amazing and funny. And they come in because they're afraid that something is going to go wrong and they just want to be ready and have all that information ready to go. So we have these folders ready to go. And they follow every rule. They have checklists. They want to make sure everything's okay. And then there'll be a fall or a hospitalization, and it's as though we've never talked about it because that fear, that piece of fear. You know, most people are a bad fall away from having somebody else make decisions. That's why it's so important to have the information ahead of a fall.
That's it, and it's an accident, right? And we never plan for accident. We don't know when it happens, and they're different levels of an accident. One's a skin knee, and one is a heavy hospitalization. So, Katie, what are the common triggers for somebody reaching out to SWCAA? Why do they come to you? When do they come to you?
Sure. Gosh, I mean, that's a loaded question. We get, we really do. We get hundreds of calls almost a week, and I mean, it can be soup to nuts. You know, it can be, you know, always around the holiday time, we seem to get a little bit of an uptick of the sandwich generation calls. The calls from the sons or daughters who came into Fairfield County to come and visit mom for the holiday. And when we came down, we noticed, you know, the week that we were here, she was wearing the same turtleneck, or she seemed a little bit off, you know, she seemed a little thin. You know, I looked in her fridge, there really didn't seem to be, you know, that nutritious food in there, or some of the food was expired. I just want to know, you know, I talked to her doctor and they provided me with this information about SWCAA. What is SWCAA? How, you know, how would you help her? I live in New York State. How am I going to do this? You know, I can't move mom up with me and I can't relocate here. So we get a number of those calls. I like to always say it's just like peeling back the layers of an onion, because again, we may refer that son or daughter to the Meals on Wheels provider. You know, we may refer them as well to the town to see what kind of services they may have for mom. But again, it's a conversation, because if mom is losing weight, if she's wearing the same turtleneck, well, let's dig a little deeper. Maybe what's going on? Do you think she's taking her medications properly? Would she benefit from maybe having an assessment for one of these state programs? You know, I can help you through the application. So we get a number of those calls. We certainly get a number of calls from, unfortunately, family members whose loved ones did suddenly have a big accident, and now they're in the hospital, and the discharge planner said she's going to go to rehab, but she's going to need more help at home. You know, I work 40 hours a week. I have kids. I can't do this. You know, so we get a number of those more urgent style crisis calls, and again, walk the family through the process of, these are the programs that your mom or dad or husband may be eligible for. You know, I'm going to email you the information, review it, you know, circle back with me. We'll get together. We have what we call service navigators. We have 2 service navigators in my department who, just as the title says, helps to navigate individuals or families through all the different services that the state or federal government or town provide, because it's overwhelming. As we just said, I was a caregiver for my own grandmother while I worked at SWCAA. I knew these programs. I worked for these programs, and it was still sitting across from the table, seeing her get assessed by a care manager. You know, it was challenging. It was hard. It was emotional. So I know how it is on the other side of the table. So we want to be able to help guide the family as best as we can, so that we could take a little bit of that stress, you know, off of them.
Let's dig a little deeper there. So, and Julie, you mentioned earlier fear. So when a senior might come in, there's going to be an element of fear that's baked into there, and it sounds like it's, Katie, with you as well, it's a very emotional time. Let's break down that sort of that intake and an introduction to both services. So I picked up the phone, I've dialed that number, and what's going to happen? Because I'm calling an acronym, right?
SWCAA, yeah, you're calling SWCAA.
And how are they gonna know what I need? You said there are all kinds of services. I don't wanna be overwhelmed, but I don't know what I need,
Sure.
but I need help.
Sure.
So there must be a process for that. You said you've done this, you do it hundreds of times
Mm-hmm.
a week. You know how to get the answer. You don't expect the person to say, hey, I need a size 42.
Oh, never.
No, not at all. So I have a team. I'm in the Aging Answers Department. I'm the director of the Aging Answers Department. Within my team is 8 team members. And I have to say they are highly, highly trained team members. I've been at SWCAA for 16 years. I've been in this department for 16 years. These ladies and gentlemen know the questions to ask. We've been doing this long enough, well enough, that I'm never expecting a family member to call me, a cold call into SWCAA and say, I need a rolling walker, I need a home health aide 4 hours twice a week, I need Meals on Wheels, I need incontinence supplies. Never, never. Again, it's peeling back, it's a conversation, and it's peeling back those layers of the onion, and as we're talking with the family member on the other line, we're hearing those trigger words where we know, okay, maybe there's a diagnosis of dementia, so let me hook this person up to the Connecticut statewide respite care program. They're saying that, they live in a 2-story ranch and the bedroom's upstairs. Okay, well, they're going to have to be connected to Wheel It Forward because they provide, equipment, or we need to educate them as to how their insurance can pay for equipment. Again, it's our jobs at SWCAA and in the Aging Answers Department to really help guide that person so that we can take some of that load off. We also do home visits too. And I always highly encourage that if the family will allow it, because once we're in the home too, again, we've been doing this for so long, we can see, oh, maybe, let's see the bathroom that mom is using. Oh, okay, we identified, oh, the toilet seat's really low. Did you know that they make a raised toilet seat? We can tell you how you can get one from a federal program for free. There's no grab bars in the bathroom, or they don't have a tub bench. They have a step over tub, but they don't have the bench to help mom guide herself into that. So again, we're able to really try to just hear those keywords and see those elements that hopefully would support that person. And then the programs that could potentially alleviate some of the cost or pay in full for some of those programs.
And Julie, because senior services in the town of Fairfield are really outstanding. I mean, we get to see across the county, so they're in this town, they're spectacular. I might be more inclined to come to Bigelow because I know it, and I know either I know Julie or I know of Julie or know somebody in there, so I've got that comfort level. So what is the experience if I decide to come to you?
We love when people come to us. If the senior is, or the child of a senior is in the senior center, we have 7 social workers, including me. It's pretty easy to get an appointment. We try to do appointments just so that we can prepare and get a sense of what somebody may be looking for. If a senior comes in, it's easy because we can sit down and talk. Like I said, we do an intake. We can talk about what specifically the person is looking for. If it's energy assistance, it's sitting down and doing that paperwork, and also assessing what other programs for which that senior could be eligible for. It's a great way. We love to do it in person. We also do home visits. Sadly, we do get a lot of referrals from police and fire when there is a fall or a neighbor is concerned and hasn't seen a senior and wants somebody to check on them. And those are sometimes challenging visits, but sometimes it's the same as Katie said. You walk in, you see what the house is like, and the senior has no idea that people were worried about him or her. They're like, oh no, I was just at my daughter's. But it's an entree to get in there, and that's always helpful. So when a senior comes in, taking our bus, the senior center bus will pick people up from their homes to bring them in for programs. Our drivers are that first set of eyes on the seniors. They'll notice if a senior is a little bit more frail, is a little bit less confident, if the seniors, looks, presents differently, if they're confused or something. The driver is a wonderful asset for us in order to get a sense of what the day-to-day is like. We notice at lunch if somebody is changing. We see people, we see a lot of seniors every day for some of these classes, if they're able to continue with their exercise classes or pickleball, if they aren't showing up for their classes. Those are causes for concern that isn't necessarily going to bring a senior in, but it's going to bring a social worker to a senior.
Mm-hmm. Do you think that the familiarity, make it more difficult sometimes, if, at least from a senior? If I am a pickleballer or I'm active, but that fear is brewing inside of me, do I want to let anybody know that I need some help? Is there a stigma to that we need to get past?
I hope not. When, I'll just talk from my experience, because I get to straddle the senior center and social services. If I see a change in a senior, maybe hygiene is off. I'm not necessarily a bull in a china shop, but I'm pretty direct to be able to say, I need to have a difficult conversation with you. I'm worried about you. Here's what I'm noticing. It always starts with, is everything okay? And it's always in private, but is everything okay? And you're right. Sometimes seniors don't want to admit that. Sometimes we don't want to admit that, right? So it does. Sometimes it is hard. I hope there's not a stigma, but there is pride. There's, people who want to stay in their homes and live on their own and don't want to have care and don't want to have us in for a home visit. I respect that. I know with my mother, when I worked as a senior center director here and also in Norwalk, my mother was, it was after my father had passed away, and she would come in, she was still driving, she would come to the senior center and talk about how cute everybody was. Be like, Mom, you're the same age. They're younger than you. But for her role was to be in there like an ambassador, but it didn't matter because it got her in there and had her seen and social.
So I want to explore a little bit why people wouldn't come to you guys. And we've had conversations about this, that sort of cliches is, we make too much money for Meals on Wheels. Mm-hmm. Do you hear that? And how do you respond to that? How do you explain?
Well, Meals on Wheels is a federally funded program. So federally funded programs have no income or asset guidelines attached to them. So we do have a Meals on Wheels assessor, nutrition assessor at our agency. She will go out and do an assessment and make sure that the individual is homebound, meaning that they're not, up driving to Target, driving to McDonald's, driving here, there, going to the casino, driving themselves to the casino. My grandmother went to the casino and she got Meals on Wheels, so it's okay, but that's because we took her up there once.
Did she bring it with her?
The Meals on Wheels, yeah. But yeah, no, federally funded programs have no income or asset guidelines. So yeah, you can, it's age 60 and older, and have to obviously have some type of need that you are deemed homebound and would benefit from the Meals on Wheels coming into your house. And again, a lot of times too, I hear, oh, my mom wouldn't be eligible for Meals on Wheels. She's diabetic. They have a diabetic diet. They have a renal diet. If somebody gets dialysis, if somebody doesn't like tuna fish, they'll do their best to make sure that on that tuna fish day, nobody's ever perfect, but on the day when it's supposed to be tuna, they'll give them the alternate. Again, that I just always say to ask the question, because don't assume.
Right. And now another one we see, especially in this area, is, well, yes, mom and dad live in this big fancy house and it's probably worth a ton of money, but they don't have a lot of income. And so they're really just getting by, and frankly, I don't know if they're getting by. So what happens then?
Yeah, that is a big issue. I want to go back a little bit to your last question. We get a lot of comments like, somebody needs it more than me. I don't need this. I've made it on my own. This is just a rough patch. And that's, and the answer is very similar to Katie. We're here to help. We're not here to judge whether or not you can afford it, but we can make it easier. There are definitely people who are struggling with tax you know, we have senior tax relief in town that is of some help. There's heating costs are very, very high. Grocery costs are very, very high. So it's really wonderful to have a home that has equity, but if you're living in it, that equity doesn't really matter when you're trying to make the day-to-day ends meet and you know, pay for gas, pay for electricity. So we do help with all those programs. Energy assistance is an amazing program. Operation Fuel, you know, when you check off on your bill that, you know, put $1 towards Operation Fuel, that helps. And there's no, and you can't say this enough times, there's no shame in asking for that help. And when a child asks on behalf of a parent, we are more likely to have the ability to get in there and make sure that parent gets help, because people are proud, and they also have the right to make decisions that aren't in their best interest. You know, people have the right to make bad decisions. We can still help once they do, but it is challenging, and there's no easy answer. You know, we don't steer anybody towards any answer about what to do about their equity or, you know, any kind of mortgage things. That's not our role, and we wouldn't do that.
I also just want, oh, I'm sorry. I also just want to add, because I get that question a lot. I get that question a lot too. You know, my mom or dad wouldn't be eligible for any state programs because they own their own house. A home is not considered an asset when you live in it. So my grandmother was on the Connecticut Home Care Program for elders. The home was in her name, had been in her name for 60 years. She passed when she was 90. And she received state services. If it wasn't for the Connecticut Home Care Program for elders, she wouldn't have been able to stay in her home. She would have unfortunately had to probably prematurely go into a skilled nursing facility. So a home is not considered an asset when you live in it.
Okay, great. Now, we touched a little bit at the very beginning about another hurdle that I think you probably run into, which is you're the state and you don't have a badge and adult protective services and that whole thing.
Yeah.
Wish you had one. Let's talk about that a little bit, both in terms of to dispel the fear, but also to understand that if we're not taking in this help, that we may be put in a position like that and what that does mean, because it is just this ominous thing out there that the state's gonna come and get me. And I want that dispelled. I want to know enough that when they will activate and when I lose some control, and how to prevent it.
I love this question. So protective services for the elderly is the adult protective services in Connecticut. We refer a lot of clients and residents to adult protective services. When we work with police and fire and there's a wandering senior, or there's a mental health issue for a young adult, we can't do protective services for the young adult, but we can if there's somebody 60 and older living in that residence who may be in danger or may be afraid to protect him or herself. We probably do 2 or 3 referrals a week, and they are remarkable. They are not there, they will not come in and yank anybody out of the house. They want to be sure that they can coordinate services and make sure that somebody is safe and getting what they need. We rely on them a lot. They do wonderful follow-up. If we refer somebody, for instance, we referred somebody in the fall who was not dementia, it ended up being a UTI, which is, you know, causes similar symptoms and behaviors, but withdrew all her money out of the bank and had it in the back of her car. It was during Peoples and M&T, and it was tens of thousands of dollars. And, you know, there's nothing funny about it, but, you know, the conversations were about, what if somebody rear ends you and that trunk pops open? And Protective Services went in, made sure she got the banking she needed, got her a companion. Police did take away her license, but her decision-making was so impaired until they did a full assessment and workup at the hospital, discovered it was the UTI, got her on her meds, and she was cured and good to go. So, you know, they are not there to pull anybody from their house or ruin anybody's life. They want to help make sure people are safe where they are.
I think that's a great case study. I'd like to hear a couple others to sort of, the anecdotals always work, right? Because if I can relate to that, I know when I'm there. And that's amazing to me because there's antibiotics and she was fine. You know, there was no ongoing thing, there was probably no care needed to be brought in, she didn't have to go to any of the programs, she needed to go to CVS,
Right.
you know?
Right.
And so, give me an idea, let's humanize this a little bit, and that, you said you may have 2 or 3 adult protective services calls a week. Small town, that's a lot, and I'm sure, Katie, that your number is just even bigger than that, and I'm sure some of them are just as mundane. If you wouldn't mind just like sharing as best you could some cases recently that show you how important it is or how easy it is, that low bar for getting services.
All right, so last week we had a woman in her 80s who is a caregiver for her husband who is bedbound, who they live in a house. She has dementia, he's bedbound. Neighbors were super concerned because she wasn't caring for herself, and it would leave him for long periods of time and then forget and go back, and we call it PSC, Protective Services for the Elderly, went to the door and they were refused entry. They can't force themselves in. So when they can't get in to see the clients, they call us back and say, well, this isn't working, they won't let us in. And we can go, because we know them, and say, well, they're here to help. Why didn't you let them in? And she was frightened because it was the state, and we had to dispel that. They're not going to take anybody away. They did determine that he had bed sores, so had to go to the hospital, which was a blessing because he needed care, cleaning, feeding, and she needed a nap. She was exhausted. And then he went to rehab for a couple of weeks. He's coming home, I think, end of next week. They predict that he'll be home at the end of next week, and she'll have the house cleaned out because there's a hoarding issue. She will have home care in the house, and the protective services piece of it made that possible because it's not as lovely as respite. It's not as lovely a way to do it, but it was important for her to get that service put in there. I'm trying to think of the other case was a family that's multi-generational, and a son with mental health issues, and the senior felt unsafe, and the protective services put in a conservator, or started the process to get a conservative for her, and also a protective order against the grandson, which was something that we had struggled with and tried to get help for, and they were able to really work that process for it.
Okay, you get any?
I'm so sorry. I myself do not have any PSC, Protective Services for the Elderly referrals that I've made off the top of my head, but I can tell you SWCAA does make a number. But just to say, like what Julie was saying, I personally do get a number of calls from protective service workers. They call me. So, for example, Julie may call out protective services for a Fairfield resident if she feels that they're unsafe or in danger. That PSC worker goes out. If they can get into the home, they do an assessment, and then they in turn call us. They call me directly at SWCAA and say, hey, I have this gentleman who just went to the hospital. He's going to go to rehab. He's going to come back home. But we've identified that she needs help. The spouse needs help. She needs some home care. Let's screen her and let's see if she's eligible, Katie, for any of the SWCAA programs. So that's where we come into play, and it's all just a big continuum of care with the goal to be getting him back home in the community with that help and getting her the help that she needs to help care for him.
Great, and you both referenced anecdotes that had a caregiver in there that needed a service as much as the one we were focusing on, which happens a lot. So let's talk a little bit about that, because it's the airplane analogy, right? Where they tell you with the oxygen, and you're supposed to put the oxygen on yourself before you, and nobody listens about that and deals with that when they're taking care of their spouse. So I know that there are programs to help that and are addressed to that. When you see that happening, what are some of the things that come to mind that could be put into place?
Sure, I'll take this one. Sure, that's good.
This is your baby.
Yes, this is what I got hired for 16 years ago. So the state of Connecticut does offer a specific caregiver respite care program. It's specifically for caregivers. Do not need to be a related caregiver, so it can be a son caring for his mother, it could be a spouse caring for a spouse. It could also be a neighbor who is caring for their next door neighbor, making sure that, you know, their next door neighbor is, you know, did they eat their Meals on Wheels today? You know, has their garbage been taken out? You know, are they looking unkempt? Maybe maybe they have a nice relationship with the neighbor, and, you know, the neighbor says, you know, can you just stay in the living room while I shower? Not that I need assistance, but just there, just in case, because I feel a little unsafe. So, the caregiver respite care program, the whole goal is to give that caregiver break or respite so that they can take care of their own needs, because we all know all too often that we're constantly giving, but then we're neglecting our own needs. And what I always say to my caregivers is, what if something happens to you? Then where is your loved one then, you know? So the state of Connecticut does offer a program where individuals, the person who needs the help, can get some care in the home. Maybe an aide coming out a couple hours, a couple days a week to make sure that woman, you know, showers safely. She's there in the home, and after the shower, you know, maybe they make a little meal together, or they do the laundry that's downstairs in the basement. You know, not always waiting for the caregiver to come home to do it. So the state of Connecticut has a version, and then the federal government also has a version. They're slightly different, and when we speak to our caregivers who call to understand it better, we kind of screen them and then just direct them towards the appropriate program.
Can I just add a little thing? Sure. We refer caregivers directly to Katie for these services.
Yes.
But we also do get calls from siblings, you know, that somebody needs a break and a sibling's not stepping up, and there's nothing we can do about sibling dynamics. As somebody from a large family, I think we could have been a nightmare example of what not to do at some moments. But, you know, the best we can do is sit and listen and say, you're doing the right thing, call Katie. Because these dynamics, these are hard. Somebody you love is struggling and you're doing your best to care for them. You're going to keep doing your best even when others aren't stepping up in a way you want them to. But there are wonderful programs that will help.
And I think that's also a great thing you just said in the capsule. The entire experience is getting validation, because sometimes when the caregiver and coming in and say, I'm overwhelmed by this is what I'm doing, I'm still overwhelmed. To be told that, no, you got that part, you're doing that right, you're good, I feel better, that makes me stronger and makes me able to do my job, you know, better. So I think that's great, that's part of the process. You had mentioned, since we're talking about getting respite or getting help, last month we did in-home and what to do within the home. And one of the speakers was from a home care agency, which of course is private pay, and they're wonderful services. They can be quite costly, and for some people that's not a solution that we can do. So what, again, you touched on it before, Katie, the Connecticut Home Care Program for the Elderly, another acronym, by the way, will get you on your acronyms. Tell us a little bit about that, because I think that's something that people don't tend to find out about until they're faced with needing it.
Sure. So the Connecticut Home Care Program for Elders is a state-funded program. It is the largest program that the state of Connecticut has to keep individuals age 65 and older in the community, whether that community may be, in my grandmother's case, her home of 60 years, or that community may be a senior housing complex or an in-law setup with a son or a daughter, but to keep that individual safe in the community by providing in-home services, supports through aides, potentially a nurse coming out, doing some medication management, potentially funding someone to attend an adult day center, which is a little bit of a step above maybe a senior center, but an adult day center where they can go have medication, Aides are on staff. It's a full 4-hour or 8-hour day, so that maybe that loved one, especially the sandwich generation, can go to work really for their 8 hours. So the Connecticut Home Care Program for Elders, again, it's a state-funded program. When someone applies, if they're in our neck of the woods, in our 14 towns, the referral comes down to us, so you're stuck with me, or you're stuck with SWCAA, but the referral comes down to us, and then we reach out to the individual and set up a time to come out and do an assessment. It is a process, I'm not gonna lie, but we walk you through the entire process to hopefully the goal being that the state grants the home care program, and then we're able to set up what the individual schedule would be. In the case of my grandmother, it started off very slowly. My grandmother was not open to having, she wanted me at 6 months pregnant, to be there. She wanted my cousins to be there. So it was very gradual with her, and that's what worked for her. And it started off a couple hours, a couple days a week, then it went to 5 days a week, then it went to 7 days a week. Eventually, towards the end, she did have a 24/7 live-in because she needed, her care needs were becoming greater and greater. That's what worked for her. The situation is different for everyone. So the care manager is with you through that whole process to help guide you and help your loved one, through that as well.
And I think that the care manager plays a really big role, because the difference between, say, if I am in a skilled nursing facility or I'm in assisted living, there's a whole organization around you coordinating all of this. You're trying to replicate that experience because everybody needs the same thing. They need clinical oversight, they need meals, they need cleanliness, housekeeping, and all that. If we're trying to do that at home, it's a little more unwieldy because we're trying to do it on our own. And that case manager is the one to corral that. Julie, you touched a little bit, I'm gonna go down the acronyms now for choices, a little random, but tell us about choices, what it is, when to do it, how, and why we should be looking at this stuff regularly.
I feel like I'm cheating on Katie right now because it's an agency on aging program. The Choices is the program for when you are Medicare eligible, so 65. 3 months before you turn 65, you have an appointment. We have a Choices counselor who's been doing for ages and ages. And there's like United Healthcare, there's all sorts of other agencies. We recommend, and my husband will be going to the Choices counselor next week because it's objective and they are incredibly well trained. So nobody is telling anybody what to do each year in terms of their Medicare, what program, and what plan to pick. But it's objective. You bring your list of medications, and it's quick, it's painless, and it's incredibly thorough. So at the senior center, you let us know you would like an appointment with the Choices counselor, and she will call and make her own appointment, and you'll see her at the senior center, or she'll do home visits as needed.
Katie, one of the strengths of the program though is that it's out, and that's why I led to Julie, is that it's accessible for somebody in Fairfield and not going through the Bridgeport office. And what you guys have done a great job is that you've planted these seeds around and it's accessible.
Yeah,
so where do we find this?
Well, we have embedded in all 14 towns volunteer Choices counselors. They go through, honestly, it's pretty rigorous training to become a Choices counselor, which is, again, a volunteer. But they go through the training. We have our regional Choices coordinator. She's on my team. Her name is Katie Wheeler. And any updates, any new information that comes down, especially during Medicare open enrollment period. There's a lot of meetings that these volunteers attend, so that again, they're disseminating appropriate, sound information back out to the community. Like Julie said, we are not salespeople. I'm not going to give anyone a tote bag because they went with, this insurance versus this one. We're just here to provide the information and the education, really. Obviously, for the basis, these men and women are gurus on insurance. I'll just tell you a quick little story. My stepmother was retiring early. There's an age gap between my father and my stepmother, so my father had long retired, he was on Medicare, but my stepmother was retiring early, and they live in Seymour, so not connected to SWCAA, but I said to him, I said, Dad, you know, you should really call South Central, the agency on aging that covers the Valley, which is out of New Haven. You gotta call Choices. You have a lot of questions. You know, I'm trying to help you, but call the Choices counselor in South Central, and he or she will help you. And my father looked at us, my grandmother had already passed, he looked, no, your agency just kind of does more the home care, and I'm the youngest of 4, so I'm already the baby, I helped with grandma, but you don't know about insurance. And I'm like, okay, that's all right. So him and my stepmother went to someone in Shelton and paid money to have this lovely woman take the Choices brochure and slide it across the desk to him and say, you know what, I think you have some great questions, you should call Choices. And that's gonna cost you $100. And first of all, I can't believe he told me. I was like, wow. And I was like, see, maybe you should call Choices now. So he listened to her, he didn't listen to me, but I gotta say, and then he raved about the Choices counselor in New Haven. He said, oh my God, all my questions were answered. Your stepmother's on the best plan for her, again, because she was retiring a little early, wasn't sure what to do. I think they still circle back actually with that Choices counselor almost every year just to make sure, okay, our medications have changed, these things have changed, are we on the right path here?
And we'll go into this a little more deeply in the next session, which has skilled care. You don't do Choices once.
No.
You look at this on a regular basis because you started at 65, and it's insurance that's appropriate and helpful for 65-year-olds is different than a 70-year-old and a 75-year-old and an 80 and an 85-year-old. And you don't want to find out when you're sitting in rehab or a hospital and they're telling you your coverage is going to constrain the type of care or the amount of time you're going to spend in a place.
Yeah.
And so you just need to change your oil on a regular basis.
I will say, isn't it gratifying to know that these two run into the same damn problem we all run into?
So thank you for sharing that. I want to finish up with a question that threw Julie a curveball and see if she can adjust to this. This concept, okay, there used to be a radio show called Desert Island Discs back in the 70s and 80s for listening to rock and roll, and you were asked what, if you were locked on a desert island and you could only have 3 discs, don't ask me how you had the electricity to play it,
Yeah.
but you could only have 3 of the programs, because Julie, you have a half an inch of programs there.
Yeah.
If you had only 3 programs, what are the programs that you just love to death?
Anything SWCAA.
Great answer.
Yeah, but accurate. We love Connecticut Legal Services because they provide services quickly and easily, and we're not talking about our own services, right?
Well, we can. It's like,
we have the senior center, but the town of Fairfield has a handyman and homeowners assistance programs if your gutters are falling off and you qualify, those programs are available. So I feel really lucky. The town of Fairfield is very, very good to its residents in terms of programs and services. Those would be my.
okay. Katie, which one? Because you guys cover a lot of services. SWCAA is not a service agency really, and you're managing all of this. So which are the most important ones? If it came to you, Governor Lamont came to you and said you can only have 3 left.
Sure. Oh boy.
If we can only have 3 left, because again, honestly, I could be here all night talking about all the programs that we have.
That's why I'm
It's
only
just
going to
that-
give you 3.
Yeah, big iceberg.
disc.
I know. Honestly, I would say number 1 would definitely be the Choices program. Again, I have the Choices brochures. It's a 1-800 number that you call. And again, we've touched a lot about how the Choices counselors help demystify the insurance aspect, especially when you're about to turn 65. But it's so much more than that too, because the Choices counselors know where the local food pantries are. They know what the asset limit is or the income limit is for food stamps, if somebody would benefit from food stamps. They know that, you know, the town of Trumbull has a free donation library. You don't have to be a town resident. You can go, and they have rolling walkers and wheelchairs and incontinence supplies, and it's just a closet, you know, not a closet, but it's you can go in and obtain that information, you know. So I mean, the wealth of knowledge that is in these men's and ladies' brains is amazing. I hear them all the time on the phone, and it's wonderful the things that they do. So choices, 100%. I would say that program would stay on my desert island. The respite care programs, the 2 caregiver respite care programs that I talked about, because when I started at SWCAA, I coordinated those programs. I've seen the changes. I had a daughter once say to me, with tears in her eyes, she said, "Thank you, you've allowed me to be a daughter again." Because she would go to mom's house every day after work. She would, you know, help mom bathe, then she'd get mom dinner, then she would, you know, whatever maybe housekeeping things she wanted to help mom do that day. Then she would go to her home family. She would, you know, bring Johnny to baseball and make dinner, and then it would just start all over again. So by providing mom an aide to come in for 3 hours, 3 days a week, she said it allowed her to just go and just have a cup of tea with mom and just talk about, oh, Aunt Susie this, or, you know, did you know that Johnny hit a home run, or whatever. She wasn't working anymore at her mom's house, you know. So the caregiver respite care programs made tremendous difference in so many people's lives. And lastly, I didn't touch upon it, but I do actually coordinate a program with the VA. So because of that, I've become pretty knowledgeable about the VA healthcare system. Of course, I do not work for the VA, but I have worked with them in conjunction with this program. So what I was able to do when my brother's father-in-law, similar to the story that you were kind of saying, my brother's mother-in-law passed away. No one really realized that Frank had dementia because Betsy was always covering for him. So when she passed away, suddenly here was Frank, my brother's father-in-law, living in this big old Victorian home in Seymour, and then it was suddenly a shock to everybody that he wasn't safe. He wasn't safe there. He was also happened to be a Korean War veteran who never accessed the VA healthcare system for anything. And that was his choice, but now when it was that he needed help at home, and he needed help at home fast, I was able to help my brother navigate through the VA healthcare system so that he could get aides into the home really quickly. He could get a ramp on his home for free really quickly because he needed a lot more equipment than they ever thought he needed. And he was able to stay at home for a lot longer than he ever would have. So I would say just the relationship that SWCAA has cultivated with the VA has been huge.
That's great. And one of those programs, so VA aid and attendance has got to be one of the
May I
most
have your attention, please? The library is closing in 25 minutes.
the program
If
of the
you
VA
need a
that most
library
people
card or
aren't
special
familiar with.
assistance, please
And
come to
Korean
circulation.
vets is a
And
perfect
just a
example.
reminder,
So
the
many of them
Wi-Fi
do
will
is
shut down
serve
at
on the
7:45. Thank
peninsula.
you.
And you say, oh, well, I didn't see action.
Yep.
But that's not the threshold for qualifying.
Mm-hmm.
And it's not a reimbursement like insurance, it's a stipend,
Mm-hmm.
which if you can qualify, and surviving spouses can qualify. So it's a lifesaver for people, and one of those programs or services that people just don't know about.
Can I just jump in one
Yep.
second? The Veteran Service office is in the Bigelow Center for the county.
Yes.
Just want to throw that out there.
You got everything, don't you?
We do.
So so Katie said something interesting in one of her last anecdotes, was that the daughter saying to her, "You allowed me to become a daughter again." Now we initiated this with, what do we start with? There's not food in the refrigerator, or it's expired, or there are things in the car, and that's what started me on this. But where we end and our goal is that, because you have to be the spouse at the end, you have to be the adult child at the end, you have to be the sibling at the end. That's the most important piece on the emotional side for the person you're caring for, that you're not just staff. And we
get lost in that sometimes. So with that, I first of all, I'd like to thank the two of you for joining us today and sharing. And I'd like to open up the floor if anybody's got any questions for these.
Thank you very much. This is really informative. I'm 66 years old and I'm currently, planning my death, I guess, with my children. So we're actively talking like once a month or so about, where the passwords are and all that stuff. And there's nothing wrong with me, I'm fine.
Mhm.
But for me to leave them with decisions like that in their vulnerable time is not, I won't allow it.
Mhm.
Right? And so I'm listening to what you're saying, and they're not here tonight, they don't live in town, but, is there a way that I could meet with you, with them, and sort of just break through the ice and tour the place or have a meeting or, just, because to me, it's sad to think that something has to go wrong before we get there. I don't understand that. Because we're heading in this direction, there's no stopping it, right? So I would rather, come have tea and cookies with you guys before you're like, what the hell, Lynn's wandering the street or something, you know what I mean? Like, how can I get ahead of it with them? Because I also feel that this experience is instructing them as adults how to plan their own, with their relationships, what happens if he dies, he just bought a place, you have to plan for that. You have to have the life insurance. And I just think there's a whole lot of denial about this whole thing of, I don't wanna be hungry and living in a mess before I get the help.
Yeah, I love this question. We're going through this with our kids too. That, you're
trending.
you come for tea and cookies, that's
Yeah.
fine. You really do wanna have a legal document though, and you can download stuff.
But I have a trust,
That's perfect. So, when, I'll just give you the experience we're having with our house. We have 5 kids. They're all adults, they're all semi-launched. We'd like a few more daters, but that doesn't matter. We've just updated our will and our advanced directives. With a history of Alzheimer's in our family, that's a concern of mine, and my husband's concerns are very different based on his family health history. So some of our kids are better able to handle the financial piece. We have one daughter, she will be the one who makes the hard decisions and tells the boys to knock it off. But they all know, we have a folder that has our will, the advanced directives, we have the DNR in the freezer in a Ziploc bag. And in this packet is a file of life that you can put all your medications on. But it's a conversation with them, and some, I don't know how many kids you have, but some of them are going to be more open to hearing it than others. But the conversation is still super important to have, and to be able to say, okay, this is hard, I get it. There's one of ours who will walk away every time, and his mother will walk back and be like, nope, we're not done yet. But what our lawyer had told us was, there's a lot you can put in your will that is instructive, but it's also important to put a letter in there to say, what's more important to me is that you're together, that you're planning for yourselves, that you have these plans and the paperwork for yourself in addition to mine, that we want you to be able to, none of this stuff in the house matters. None of nobody cares about grandma's silver, and nobody does care about grandma's silver. I don't get that, but it's that kind of stuff. And in that letter that goes with all of that paperwork in that box or the folder, everybody will have access to seeing the same thing at the same time. But it is having that conversation now, and you're right, mirroring what you want them to do for their future selves and updating it. And the longer you wait, my sister has it down, her plan's down to who's saying the mass, what the songs are, all of that.
Yeah,
And
but that's the dying part. What about the living part? How can I meet with you guys and share with them who to call or what we know we can rely on and things like that?
Right. Well, you certainly come to social services. We can't legally do that paperwork, but we can give you a lot of information, recommend a good lawyer. But
No, but I mean, I can't get to know the services, like I can't pre-enroll or something like that. You know, if something has to go wrong, or,
Well, so, I'm sorry,
No,
I
you
didn't
go.
mean to jump. I mean, you wouldn't be able to technically like pre-enroll in the Connecticut home care program for elders, you know what I mean? Even though you're age eligible, you have to meet there are financial requirements. Also, you would need to demonstrate a need today. Do you know what I mean? It's not for like
no, I
future,
don't
you know?
that's what I wanna know those things.
Sure. So, I mean, I certainly could, for you or for anyone, and I do this a lot, because knowledge is power. I do get a lot of calls from children, or even, a senior themselves, and just tell me, what can your agency help me with? I'm fine right now, I'm fine today, but, Lord knows what could happen, next month or next year, so where do I begin? So normally what I do is I email that information all to them, email them the links, because I'm sending them the information that's current today. 2 years from now, the income or asset guidelines will obviously change, but at least they have the information all in one spot, in one email, that they can then disseminate to their kids and be like, hey, I spoke to this lady, Katie Regan. Trust me, I'm not going anywhere. I've been here for 16 years, but I spoke to this lady, Katie. She works at SWCAA in the choices department. This is where you wanna direct if you start to see some changes in me. If you start to notice some changes, or you yourself, if gosh forbid, financially you were to fall on hard times and needed energy assistance or SNAP benefits, again, you could refer back to us.
And you can certainly come in and we can meet with you and like if you were to go to the hospital and then you needed home care. So you have an idea of what that looks like. I get what you're saying. I also, I think that it is hard to predict, and it's great you're thinking in these terms ahead of time. That's a gift to your kids. And
Well, they watched me care for 2 elders, and so they saw what the cost was for me and them, the upside and the downside.
Right.
But I know with my aunt, we pre-enrolled her in a, I think it was Chamberlain, yeah,
a skilled nursing facility.
yeah, ahead of time. So when she ran into trouble, she had a place to go that was all set up, all the papers were there. So it's that kind of thing that I wanna make them aware of, so they're not feeling responsible and staying too long to get the care, you know what I mean?
yeah, so they're not winging it. They
Right.
know that they're following the wishes you had lined up and ready to go.
Right, cause what you're describing, I didn't understand with all the people I cared for, that this wealth of services available. I mean, it's pretty incredible.
It is. So you should have your kids bring cookies to Julie.
That's what I'm thinking.
You already got it.
Yeah.
And don't you wish you could bottle that
Yeah.
you had people who were thinking that far ahead?
I know.
I
Yeah.
do, I think it's
So kudos to you that you think about it.
4 years ago, I wish somebody told me what to do. My husband was in the hospital, he was in convalescent homes, back home, back to the house. Nobody told me about these services. I had no advocate. I didn't know that the hospital bed was going to be paid for. I didn't know any of that.
right.
Who should have told?
There was no source you could thank your public library for having a program that's teaching.
Yes, I wish, I wish I had come to something like this 4 years ago.
I agree. I'm a social worker, and I felt that way with my parents. It's a lonely feeling to not know what steps to take and to
Right.
not be able to be prepared for that. The senior center does have some programs. The library does have some programs. We can't be the be all and end all, and everybody's not comfortable only coming to the senior center, which is why the library is so remarkable, and why these programs are remarkable in different communities. But you're right. Until you don't know what you need until you need it, and then it's a scramble,
Right.
and that's really hard.
So we are up against a hard deadline. one more question, but understand that what we try to do with this series is introduce you to people and the concept. They're all here. Across that table are pamphlets from the previous speakers. So you just start accruing your assets and dial the damn phone. Get and talk to people and ask your questions. Continue the conversation. It doesn't end now. It's gonna end because the locks on the door get locked at 8 o'clock. And while I have slept in this building, I do not want to sleep overnight. So if we can have, good.
I just want to ask you, are the sponsorship services, are those free or is it fee based on your income? Sure.
My answer would be it depends. So it depends on which program your loved one was on. Some programs do have what's called a cost share, which means that the state of Connecticut will pay 80% of the cost of the services, and then they ask that the client or the individual receiving the care pay the other 20%. That's particularly one program. A different program is entirely free. Another program has a 2% cost share. So again, the state is paying 98% of the services, asking that the individual pay 2%. So it varies. But again, that's the job of us and my team and my department to educate you so that, and we educate you, and then when the care manager comes out, they as well educate you. And I've sat across from the table from many people, and they've said, thanks, but no thanks. We don't want to pay 2%, or we don't want to pay 20%. Okay, that's fine. It's been lovely meeting you. Please, here's my card. Call me if you change your mind. We're not going to send you a bill for us coming out. The state of Connecticut's not going to slap your hand and say, oh, you were offered it once, you don't get it again. Things change. So that answers your question.
Thank you.
And you had a last question?
Oh, well, maybe it's more of a comment. I
Okay.
learned everything backwards. How important it is to share with people. First of all, people don't always die in the order of their age.
Right.
Okay, and my brother didn't even bother to tell me that he left me completely full control of his life. And so I'm literally flying by the seat of my pants. And he had a heart attack 2.5 years ago. I knew nothing. It took me a month to get new. I just can't tell. No one knew what any of his wishes were. He's still alive.
Yeah.
But, it's just been a horrible, I basically